In this video, we're going to talk about what causes tonsils and how to prevent them. So before starting this video, like this video and subscribe to our YouTube channel for future updates. Tonsillitis symptoms usually appear out of nowhere. Symptoms that are common include an itchy or sore throat, swallowing problems or pain. Tonsils and throat are red and swollen. A white, yellow, or gray coating on the tonsils or whitish patches on the tonsils. Fever of more than 100.4 degrees. Lymph nodes swollen, glands on the side of your neck below your ears. Vomiting or stomach ache, more frequently in younger children. What is the cause of tonsillitis? Tonsillitis is caused by a virus or bacteria. Tonsillitis is divided into two types. Tonsillitis is caused by a virus such as cold or flu in the majority of cases, up to 70% influenza. Other types of tonsillitis, such as bacterial tonsillitis, strep throat, are caused by Streptococcus group A bacteria. Strep throat is the colloquial name for bacterial tonsillitis. What causes tonsillitis in people? Tonsillitis is caused by viruses and bacteria that are very infectious. They're distributed by kissing or exchanging of food, drink, or utensils, coming into close contact with a sick person, touching your nose or mouth after touching a contaminated area. When a sick person sneezes or coughs, small particles become airborne and are inhaled. Tonsillitis is diagnosed in several ways. To determine if you have tonsillitis, your doctor will look for redness, swelling, or white spots on the tonsils in your throat. Other symptoms you have had, such as fever, cough, runny nose, rash, or stomach ache, should be mentioned. Look for signs of infection in your ears and nose. Check the lymph nodes on the sides of your neck for swelling and tenderness. After confirming a diagnosis of tonsillitis, your doctor must identify whether the infection is caused by a virus or bacteria, strep throat. What are the symptoms of strep throat? To discover if you have strep throat, your doctor may request a throat culture, often known as strep test. A throat culture is basically a test that examines your throat for the presence of a particular germs. During a throat culture, you should to collect saliva and cells. Your doctor will sweep the back of your throat with a long cotton swab. Although the test is unpleasant, it is not painful. Your doctor will screen the cells for bacteria while you wait. A rapid strep test is the name for this type of test. In around 10 to 15 minutes, you will have your results. If the test detects bacteria and the results are positive, your doctor will prescribe an antibiotic to treat strep throat. Your doctor may send the sample to a lab for more thorough testing if the findings are negative and the fast strep test does not reveal bacteria. The results of this lengthy lab test normally take 2 to 3 days. If the lab test findings are negative, the tonsillitis is viral rather than bacterial. What are the symptoms of tonsillitis? Tonsillitis is characterized by a sore throat, swollen tonsils, and difficulty swallowing. You should see your doctor to see if the tonsillitis is caused by bacteria or a virus. The type of infection determines the treatment. What are the options for treating tonsillitis? The treatment you receive is determined by the cause of the infection. The treatment you receive is determined by the cause of the infection. Although the symptoms of the viral and bacterial tonsillitis are often identical, the treatment are not. What is the strep throat treatment? Antibiotic medicine is used to treat strep throat, bacterial tonsillitis. Antibiotics are only available with a doctor's prescription. Antibiotics are normally taken orally by mouth for 10 days. The following are the most commonly prescribed antibiotics for strep throat. Penicillin, clindamycin, cephalosporin. Even if you feel better after a few days, it's critical to follow your doctor's advice and take the entire course of antibiotics. To prevent infection from returning, worsening, or spreading to another part of your body, you must finish the antibiotics. What's the treatment for tonsillitis caused by a virus? Antibiotics that are used to treat strep throat, bacterial tonsillitis, will not work on tonsillitis caused by a virus. Your doctor will prescribe the following to treat symptoms of viral tonsillitis. Rest abundantly. Stay hydrated with fluids. Ibuprofen or acetaminophen are examples of over-the-counter pain medications. Lingual lozenges. What are the potential problems of tonsillitis? Tonsillitis complications are frequently linked to strep throat, and the streptococcal bacteria among them are Chronic tonsillitis is defined as tonsillitis that occur more than 7 times per year. Doctors may recommend tonsil removal surgery, especially if you snore or have difficulty sleeping at night. Tonsillectomy is the name of this procedure. Scarlet fever can develop from strep throat, resulting in red rash and a high temperature. Scarlet fever affects children more frequently than adults, but it's not prevalent. A peritonsillar abscess, an accumulation of pus surrounding the tonsil, can arise in severe cases of tonsillitis. Adults and teenagers are more likely than children to develop peritonsillar abscess. Surgical drainage of the abscess is frequently recommended by doctors. Rheumatic fever can develop if strep throat is not treated or if antibiotics are not taken for the full course of treatment. Rheumatic fever is more common in youngsters than in adults. It has the potential to cause lifelong heart damage. Infection spread. Streptococcal bacteria can spread from the throat to the middle ear, sinuses, and other regions of the body if left untreated. Complications of this illness include sinusitis, glomerulonephritis, and necrotizing fasciitis. What can I do to alleviate tonsillitis symptoms? You can treat viral and bacterial tonsillitis symptoms by taking acetaminophen or ibuprofen, over-the-counter pain reliever. Warm drinks such as tea, apple cider, or both should be consumed. Warm salt water should be gargled. Throat lozenges may help. How can tonsillitis be avoided? To lower your chances of getting tonsillitis, you should. Hands should be washed frequently, particularly before touching your nose or mouth. If someone is unwell, don't share food, drink, or utensil with them. Regularly replace your toothbrush. What is the prognosis for tonsillitis patients? With plenty of fluids and rest, viral tonsillitis usually clear up in a few days. Antibiotics typically cure bacterial tonsillitis, strep throat in 10 days. Tonsillitis rarely causes major health consequences. What do you think about this video? Do let us know in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit the subscribe button before you go.